Hello, dear organizers and participants of the conference. We are first-year students of the Faculty of Pediatrics, Konnova and Polina Dесятова. We would like to present to your attention a report on the topic Virtual Reality in Emergency Medicine, Augmented Reality and Virtual Reality. This is a practical experience of a relevant environment in real time with the help of digitally created three-dimensional presentations integrated into real incentives and existing reality. If it is a fusion of the real and virtual worlds into a single, existent and unified reality. Google Glass and Microsoft HoloLens are the instruments most commonly used. Google Glass focuses on technology that runs on almost all smartphones. Still, the HoloLens is moving towards depth sensing that can recognize and interact with the environment and recognize human gestures, the latest trend in AR. VR is an interactive three-dimensional computer that generates a simulated environment completely distorted from normal reality, where people can interact using special equipment. It provides an immersive, interactive experience for users similar to their daily life experience, and this realization of presence has potential for application in the healthcare system. Hospital and disaster medicine. The number of pre-hospital and disaster medicine studies plays a crucial role in our review. Disasters are an inevitable truth of our life, prompting us to be prepared for the future. The immersive, low-cost, and replicable features of VR technology will better equip the healthcare system to withstand disastrous impacts in the future. Triage skills training is studied both in AR and VR. Gradually, health providers are focusing on training for optimized decision-making and action-taking during mass casualty incidents. The advancement of technology in the mirror world will have vast potential as the virtual world is synonymous with the daily environment and will be helpful for disaster simulation and preparation. However, most simulation training systems still have deficiencies in their application experience. The most common barriers are efficacy, evolution, and privacy concerns. The lack of evolution functions means an inability to determine the level of skill acquisition, and the corresponding privacy protection research is urgently needed to reduce privacy leakage. Education. Education is the main field of application for both AR and VR. Emergency medicine is an early adopter of technology-based education tools because of the need for skills and ability to adapt to a variety of emergent clinical scenarios. AR and VR integration into clinical training may be an effective educational strategy that enhances skills and knowledge learning are improves that experience is a simulated environment. Therefore, the trend of the metaverse in emergency medicine education, especially resuscitation, will be carried forward because of its applicability in teamwork, learning, decision-making, and high-stress immersion resuscitation experience. We believe that the application of AR and VR in education will continue and grow, and the latter has more potential because it reduces the need of real-world stimuli. Furthermore, the concept of the mirror world is also being explored, and it may emerge as popular once the cost as techniques are finalized. By actively utilizing the characteristics of the metaverse, a higher degree of freedom and a greater variety of environments will be provided for creating, sharing, and learning not only for students but also for teachers. So far, its effectiveness compared with traditional educational methods is still equivocal in some studies, and further research with a larger sample size needs to be conducted to understand the feasibility and effectiveness of such a curriculum. Furthermore, future studies can attempt to characterize the best uses for AR/VR, analyze the positive and negative effects on students' learning activities, and incorporate the findings into conventional medical and educational methods in a better way. Moreover, emergency physicians and emergency medicine societies should become more involved in metaverse technology development and assessment, promoting simulation platforms across specialties through interdisciplinary and multi-team collaboration. This extracted thematic category in emergency medicine has fewer applications than other subspecialties. However, these classifications of applications will greatly increase, especially in AR and live logging, once the technology advances. There has been diverse research on emerging concepts and applications of AR that are novel. However, most are pilot studies and need to be explored further. VR interventions are emerging as promising tools in acute pain management, especially in pediatrics. VR will be a potential tool for information transfer and communication about disease knowledge, medical processes, and health concept education in emergency care practice. Thus, we may assume that AR has more potential and applied value in the future because of its capability to integrate with real-world stimuli and existing reality in clinical practice. So far, the effect in clinical management is still limited, but some techniques seems to benefit physicians, although more application and evidence are needed in the future. The healthcare lifelogs can eventually explore valuable results from big data as they collect real-time data of various types from individuals. Still, health providers in acute care do not yet seem to benefit. Much research has been conducted in recent years to discover different life-logging attributes, but most current surveys are not very comprehensive, being limited to a single aspect. There's a significant potential for life-logging to be used with healthcare to enhance current practices. It can provide clinical data such as medical compliance, the rhythm of heart attack and pattern and center of syncope or cerebrovascular accident via its wearable devices once the technological challenges are overcome. With a growing trend to broadly adopt wearable devices and the rapid progression of IoT and big data science, life-logging will soon play an essential role in clinical practice for acute medical care in the foreseeable future. Healthcare systems will capture, analyze, and store personal data in some external gimmick which may raise ethical and legal questions. Privacy is still a top concern since the user's loss of autonomy and data might result in an individuals being taken advantage of by commercial entities and governmental agencies. In future research, it will be necessary to explore clinical relevance and evidence, especially regarding privacy. It would also be advisable to expand the study of such devices to consider compatibility among people who are not acutely ill, including those with systematic risks such as heart disease and hypertension.